Okay, good afternoon, everyone. Today we have a special edition of our weekly program, TCM LED Talk, which means let's explore and discover traditional Chinese medicine, or TCM in short. So the topic of today is when in Rome, because you know that there's also is a epidemic, or the pandemic is all over the world, is also hit Italy. So when in Rome, do as the Chinese do. So what I mean is to bring your, this is a platform, TCM LED Talks. You can bring your short stories of the medical professionals in your hospital, so how they make the best of both Chinese medicine and Western medicine in improving health and advancing research. So traditional Chinese medicine, there's no doubt, this is one more choice for the COVID-19 or new coronavirus symptom management. Today, I'll focus on something old and something new. But I'll borrow something, and in the meantime, I'll bring you something that's feeling good. Just a flashback of what's happening around the world. This is coronavirus today. This is a special edition of our TCM LED Talk. So this is update of TCM interventions in management of COVID-19. I'll focus today on prevention. So this is a continued medical education, CME, or continued nursing education, CNE, in Beijing and beyond. So what this is, I'll tell you what's the local government health agency that the Beijing administration of TCM, what they are doing, especially in the arena of prevention and mitigation. So Beijing, that's what the headline from CNN just a few days ago. So Beijing is promoting traditional medicine as a Chinese solution to coronavirus, but it's true. So if you take the world as a whole, so not everyone is on board. So China, so the good thing is what encouraging us is China passes outbreak climax. So this is true. We want to take a victory lap and over our handling of the coronavirus. And if you look at that, since the WHO, so the Secretary General announced, so this is a global pandemic, but the rule of the game is never give up. So just a few days ago, it became a pandemic, from epidemic to pandemic. So look at this. So medical justice, this is a developing story. It's happening right now, every moment in China. So the medical assistants, there's the medical doctors, the medics, so they are leaving the hard-hit Hubei province, Wuhan. And also Chinese, we are sending our medical experts to Italy, now Serbia. So more countries, so we help the world in combating the virus. So at the moment, we say there is no vaccine and there's no specific therapeutic, there's no treatment, and they prove that's effective against the virus itself. But both traditional Chinese medicine or Western medicine, in WM for short, so they are both supportive. So China, remember that we have all the medicines, therapies, equipment deemed supportive for patients. We have oxygen. So this is a modern technology. We have oxygen. We have antibiotic. We have cough medicine. We have ECMO, that's artificial heart and lung. For some cases of the COVID-19, the coronavirus cases, TCM decoctions can be complementary or alternative. So this is a fact. It happens in China. Because for symptom management, for overall well-being and the quality of life, like TCM for cancer patients, that we have been using this strategy for all the cancer survivors. So this is a very, very important principle, that while we are using this TCM, does not mean backing what is known to work. That means we use all the supportive means and saving life technologies in the modern medicine as well. So TCM, President Xi said, TCM and Western medicine is key. So treatment should combine traditional Chinese medicine and Western medicine. More effective drug could be applied and new treatment method explored to prevent patients with mild symptoms from being seriously ill. So if you look at it, we have an array of research that's being conducted in China. This is registry. You can see this is an intervention from traditional Chinese medicine. It's happening today. And also, this is our deputy director from the administration, the National Administration of Traditional Chinese Medicine. What, Madame Yu said that we are willing to share the Chinese experience in treating the novel coronavirus pneumonia with TCM, and more countries know about TCM medicine. So here she listed, several advantages by using TCM, and sometimes alone, most of the time together with medicine, what can be achieved. And also the commissioner of the Beijing administration of TCM, Mr. Tu Zhitao, also said that in Beijing, there's nearly 90% of the patients had been given TCM, as of the end of last month. And among them, 92% of them showed improvement. So this is the fact. And also for prevention, this is the focus of today. So this is two meanings of prevention. This is treat before sick. This is the first meaning. Second meaning, for seriously ill patient, TCM help relieve symptoms and restore blood oxygen saturation, preventing the patient's condition from developing into critically ill cases. This is the second meaning of prevention in TCM. So now we can see that herb as a helper. There's no doubt. This is a number. This is what I said. Before the 2008 Olympic Games. What I said, the number of TCM-related research is underway. So what I said, we need, at this moment, critical moment, we need to join hands to promote rational use of safe and effective Chinese herbs and map out a more standardized and evidence-based practice of integrative medicine. So, something that we can learn, and we know this in the US, because it's a right to try act, was signed into law last year. So this law is another way for patients who have been diagnosed with life-threatening diseases and conditions, who have tried all approved treatment options and who are unable to participate in a clinical trial to access certain unproved treatment. So we know that circumstances alter cases. At this moment, TCM for COVID-19, for this new coronavirus, is the case. So this WHO expert, this team leader in China, this is an interview in the report. He said that I would like to be treated in China if I caught the virus. This is not hype, and this is not face hope. So facts help people outside China, build up their confidence and a sense of more control over the pandemic. So this is a report. You see, it's a report of WHO China. This is a joint mission on coronavirus 2019. So it mentioned clearly that it's documented here, there is widespread use of traditional Chinese medicine, TCM, for which the effect must be fully evaluated. What we are doing now is evaluating the result. And also, this is another, during the New York Times interview, when asked, are they testing traditional medicine? This is his answer, the expert's answer. Of course, but a few standards. We do use a few standards formulations. It's not some guy is sitting at the end of the bed cooking up herbs. They think they have some fever-reducing and anti-inflammatory properties, not antiviral. But it makes people feel better because they are used to it. And this TCM online. So what we are doing, we are training. We are training all the doctors and nurses, automatics has been actively involved in this combat. So this is the 7th edition of the Diagnosis and Treatment Guideline on COVID-19. The TCM has been proven in this guideline, we say TCM has been proven effective in treating the patients. And patients with mild symptoms have been seen, seen their fever and cough elevated. For seriously ill patients, TCM helps relieve symptoms and restore blood oxygen saturation and preventing the patient's condition from developing into critically ill cases. So prevention. So we provide the world with our way. So TCM, this is a TCM. What is the idea behind the TCM prevention? So TCM unique theory and practice in preventing the plague. So in history, very well documented. It helps boost the body's overall immunity. This is TCM target, and focuses on enhancing the body's own resistance and restorative ability, and maintains an overall inner balance. So this makes it useful in preventing infectious diseases when vaccines are not available. So this is the situation we are facing now. So evolving situation, dynamic response that we need, so, and understanding more. So treat before sick, this is a theory in TCM. So during the release in this guideline, during the medical observation period, so what we can use, and for those presumptive cases, that suspected case, what we can do. So you can see this through the tentative 6th edition. We can see this prevention guideline. This is advice guideline on the Beijing administration of TCM on their website. So TCM for preventive for the general public or for special population. So the idea behind it is food as medicine. This is not one-size-fits-all solution. It's not one-size-fits-all solution. This is TCM. This solution can be regarded as an immune booster. And also, this is not COVID-19 specific. What I mean that for other kind of plague, it works the same way. And we say in TCM, you will never succumb to any external pathogens if your healthy qi is robust. So what we need to know in TCM preventive measures is to stamp out the viruses in a different way. So we need to build up our defensive qi. So this is the key. And this, you see the diversity in harmony. So in this city, so what name is Healthy Beijing, you see really a tale of two medicines. So keep calm, nurse on. So this Florence Nightingale, this is the winner of that award of last year. She worked on the front line. So she praised in the use of TCM and together with Western medicine. So this echoes what we are promoting exposing traditional Chinese nursing care. So we have our this is annual seminar on this. So our topic for this year, later this year, I hope, it will be keep calm, nurse on. This our experience with coronavirus from the perspective of nursing care of TCM. So look at this. We encourage our patient to learn Tai Chi. This is restore your inner peace. And also we have the similar exercise, Ba Duan Jin. This is what happened. And also we have the director Tu Zhichao also mentioned during an interview with CCTV, so about our helpline and hotline for those English-speaking communities. So remember, that Professor Cui's Nobel Prize is not the only way making TCM recognized worldwide. So biological, psychological, and mind-body approach is right now taking center stage. So Beijing TCM helps you make sense of it all. So you can have more on this website. It's TCM Live, that's TCM Online. And also we have, this is a special program of our TCM LED Talk and Old But Gold program. Thank you.